Good evening, Dr. Adeshida.
Good evening, madam.
It's really nice to meet you. I'm Damilola Olukorede.
Nice meeting you too.
Okay, thank you very much, sir. So we'll be starting the event shortly. We're just waiting for some other people to, join on the website. So what is going to happen is they're going to be typing in their questions, and I'll be reading it out to you. So you just help us provide some answers to it. So I think we have about 1 more minute to start. So we'll get to it. Okay, so it's 5 o'clock already. So I think we can start reading out the questions now. So I'm just going to start with some of the questions that we already have on hand that we want to have answered from, our audience. So, sir, please, can you just help us explain what infertility is to start with? What exactly is infertility? Okay, so while we are waiting for the other people that the links are being shared to join, I just want to talk briefly about health facts, what we do, and then about our guests also that we have here today. So Health Facts is an online platform where we majorly share health information. We share daily health information that is relatable for several people. If you follow our websites, you can access health information that are useful, that you can incorporate into your daily lifestyle. You can have lifestyle modifications from some of the things that we post if you apply them. Then also about our guest for today, our speaker, Dr. Adeshida, is a family physician, and he makes a lot of posts and talks about gynecology generally. So he's here today to give us some answers to questions about infertility. So if you're just joining us, all you have to do is just type in your questions into the discussion panel. Once you type in your questions, I'll be reading it out to him, and then he will help us provide answers to them. So even if you are here with us too on Zoom and you have a question, please just type it in the chat here so that I'll read it out for Dr. Adeshida. Okay. And also, doctor, if you can see the questions in the chat yourself, even if you're having like problem with the network and hearing, you would see the question on the screen and you'll be able to provide answers to them. Okay. So the time is around 5:06 p.m. now. So I think we can go ahead and just start asking some questions. Would that be okay, sir?
Yes.
Okay.
I'm good to go.
Yes, sir. So I know other people will be joining us with time, but please let's take note that this video is being recorded. It will be available on our website. So even if you miss any part of this, it will still be available on our website to check it out. And as I've said before, for people that are just joining us, Health Facts, we are an online platform where we provide health information to people. We also put out quizzes whereby you can take our quiz and you can get a lot of corrections to some misinformation. We do a lot of myths or truths whereby you can take the quiz to test your knowledge of some of the ideas that you have in mind about some health situations. If they're actually truths or myths, you can be taking some of our quizzes, you can be reading our articles, and then to get health information that you can incorporate into your daily lives. So we're about to start now. I'll be typing out the first question in the chat. It's in the chat, so that's the first question. What is infertility?
Okay.
Yes, sir.
Infertility can be explained this way.
Okay.
It is said to occur. Infertility is said to occur when a man and a woman are having unprotected sex, unprotected adequate sex for 1 year if the woman is less than 35 years, for 6 months if the woman is more than 35 years, and this sexual adequate unprotected sexual intercourse does not result into pregnancy, or it results into pregnancy, but the pregnancy does not result into a live birth.
Okay.
So the next question you want to ask is, what is adequate sexual intercourse? It is when a man and a woman are having sex at least 3 times in a week, alternate day. That is adequate sexual intercourse. So if two people, a man and a woman, they are having this, they are not protecting it, and yet there is no pregnancy for 1 year. If the woman is less than 35 years, and if the woman is more than 35 years for 6 months, that is infertility.
Okay.
And if there is pregnancy, the pregnancy does not lead to a live birth, delivery of a baby is still infertility.
Oh, okay. So it means it is possible to be pregnant and still be infertile.
Yes, until the pregnancy leads to a live baby. In fact, World Health Organization, that is what they are now laying emphasis on. It is not even, yes, it's about getting pregnant, but World Health Organization is now more interested in it leading to a live birth. So what is the essence of getting pregnant without getting the results? So it is still as good as not getting pregnant at all, as far as World Health Organization is concerned. So that is the latest definition now. The pregnancy must lead to a live birth. You must carry your baby like this. You must have a result to show for it before they can say, yes, you are not infertile.
Okay, sir. Yes, thank you very much, sir. Thank you so much for that answer. I'm sure people are already, learning from this, and we also already have other questions coming in. So we have a question here. Someone is asking, are carrots good for enhancing fertility?
Yes, very good. Very, very good. Carrots contains a lot of vitamins, and vitamins generally, from all the vitamins are good for anybody who wants to conceive. So carrot is good.
Okay.
Carrot is very good. It can enhance fertility. It contains a lot of ingredients.
Okay. So the next question here is, are there habits that we practice as young women that make us infertile? Are there habits that young women practice that can make them infertile?
Yes, a lot of habits. Number one on them, the first on the list is sexually transmitted disease. When a young lady is having unprotected sex with multiple sexual partners, and from this, she's at the risk of sexually transmitted infections, which most of them can lead to pelvic inflammatory disease. And this pelvic inflammatory disease has been adjudged to be one of the greatest causes, one of the commonest causes of infertility worldwide. That is number one behavior, sexual behavior. Unprotected sex, multiple sexual partner, all this can lead to infection that can lead to PID, and PID is one of the commonest causes of infertility worldwide. That's number one. Number two, smoking. Smoking has been confirmed, has been researched widely to be one of the causes why a woman may be having problem with her ovulation. The woman may not be able to ovulate, or the smoking can tamper with the egg of the woman, and the woman may not be able to conceive. So most ladies, some even smoke shisha, and they will claim that, shisha is just is not as bad as smoking cigarettes. They are all in the same category. In fact, shisha is worse than smoking ordinary cigarettes because you are inhaling the smoke directly. So all this can cause infertility, smoking of any form. That's number two. Number three, substance abuse. A lot of drugs can cause infertility. If you are abusing all these drugs that have been banned, amphetamine, cocaine, all of them, they can lead to infertility. Apart from this, most women drink alcohol. A lot of people think alcohol is harmless. It's not harmless. It can tamper with the egg of the woman, and it can lead to infertility. Another one is what we eat. A lot of people are not exercising, and they are not physically fit. They are not physically active. They eat a lot of fats, and they end up being obese. Obesity, overweight, has been taken to be one of the causes of infertility worldwide. if many people are infertile because they are obese. Another thing is that a lot of us, we will say, oh, I don't want to gain weight. Just the way overweight and obesity can lead to infertility. A lot of ladies want to be like a model. They want to be slim. It can lead to infertility. When you become underweight by the lifestyle you are living, you don't eat well, you don't eat a lot of food, you don't eat good food because you want your shape to be maintained, you don't want to add a lot of weight. It can lead to infertility. Apart from this, exercise is one of the things that has been adjudged to be one of the causes of fertility. When you exercise, it can make you to be fertile. But how many people exercise? So lack of exercise can lead to infertility. So that is another thing that can lead to infertility. So there are a lot of things we do. Our lifestyle generally can lead to infertility. And the same thing goes for men. Almost everything I've said now can lead to infertility in a man too. A man that is smoking can have a low sperm count. He can have sperm that is having problem in quality. The sperm is not mobile. It cannot swim very well and enter into a woman and become a pregnancy. The same thing goes for alcohol. The same thing goes for substance abuse in a man. And some men, what they do, they will place their laptop on their laps. Yes, it is called laptop. But if you place your laptop on your lap, the heat that is being generated from the laptop, it can affect your scrotum. And if it affects the scrotum will not be able to produce egg. That is why God made sure that testes are outside the body of a man, because the temperature that testes can be optimal to produce sperm is lower to the body's temperature. That is why God made the temperature of the testes to be outside the body. It must not be too hot, it must not be too cold. That is why when there is too much cold, you see that the testes will go near the body, it will go up. And if there is too much heat in the body, the testes will move down. It is because it must be maintained at a particular temperature before it can produce good sperm that can lead to fertility in a man.
Okay, thank you very much, sir. That was a very, very detailed answer. And I'm sure that you were able to even cover for both the male and female aspects. So there's someone asking here that what can one do to prevent ectopic pregnancy?
Yes, the commonest cause of ectopic pregnancy, like I said earlier, is pelvic inflammatory disease from sexually transmitted disease. PID from sexually transmitted disease is the commonest cause of ectopic pregnancy worldwide. So you can see now. So if you are saving yourself from a lot of things when you have a protected sex, or better still, abstinence if you are not married. But abstinence is 100%. If you don't go near it, you don't get it. But if you use condom is not safe. Condom is 97%. Even if you use it correctly and consistently, there is still risk of the condom breaking. And this can lead to sexually transmitted disease. It can lead to unwanted pregnancy, which can lead to abortion. Abortion that is possessed criminally can lead to infertility. So can you see the connection now? Ectopic pregnancy, if you want to protect yourself from it, make sure you avoid unprotected sex. Of course, there are other causes of ectopic pregnancy. One of them is if you take a lot of fertility drugs too much. Maybe some people that are taking clomiphene, it can lead to ectopic pregnancy. Apart from this, when you have unprotected sex and you take prostanol, this prostanol, if it fails and that pregnancy occurs, the pregnancy is ectopic pregnancy until proven otherwise. If you take prostanol and the pregnancy still occurs, it escapes your prostanol. That prostanol will make the movement of the pregnancy that is supposed to go to your womb to stay in your tube, and it will lead to ectopic pregnancy. Another thing that can lead to ectopic pregnancy is smoking. You can see, we are back to what you have said earlier. Smoking weed, yes, smoking shisha, smoking cigarettes, all these can lead to ectopic pregnancy in a woman. Another thing that can lead to ectopic pregnancy is if the tube is having problem. If the tube of a woman, maybe from the womb of her mother, she was born with a tube that maybe has kink, or a tube that has some malformation, it will not allow the fertilized egg to go into the womb, and it may stay where that kink is, and then it can stay there and lead to ectopic pregnancy.
Thank you very much for that answer, sir. We can see that even it still leads back to many of the things you discussed initially about the causes of infertility. Yes, and it's still a bit intertwined with the with the STDs and the PID. So I'll read out the next question. What is the ratio of infertility due to males compared to those resulting from female factors? And this person is asking that what's the ratio of infertility caused from male factors compared to those caused from female factors? Does infertility result more from male factors or from female factors?
Equal proportion. 20 to 30% of infertility are caused by men. 20 to 30% of infertility are caused by women. 20 to 30% are caused by both. And then 20 to 30%, or let me say 10 to 20% are unexplained. Now, when I say both, 20 to 30% are caused by both in the sense that the man is having a problem and the woman is having a problem, both of them jointly. We see more of single factor, either a male factor being responsible or a female factor being responsible most of the times in the consulting room. But sometimes too, you can see both the woman and the man having one problem or the other. So at the end of the day, 20 to 30% is caused by male factor, 20 to 30% is caused by male factor, and the two combined, 20 to 30% too. Then 10 to 20%, you have done every available test. I repeat, every available test you can lay your hand on. There is no problem with the woman, there is no problem with the man, yet they cannot conceive.
Okay, all right. Thank you very much. So let me just quickly follow it up with a similar question that I can see here. That is every case of infertility curable? Are some incurable by medical science? That is every case curable, or are there some that are just incurable?
I can confidently tell you today that every infertility is curable. Every. And I will explain myself. I will tell you why I said is curable. But before I explain that, but unfortunately, culture, religion, and tribal sentiments, family sentiments are the impediment. Financial sentiments, financial handicap are the impediment to some solutions. Social stigma, stigmatization, all these are the problems to some of the solutions to the problem of infertility. But every infertility is curable. And I will explain myself. Why did I say it's curable? Look at it this way. You know, the commonest causes of infertility, like I said, is when the egg of the woman is not ovulating, is having menstrual problems, and the egg is not being released. And then another one on the part of the man is for the sperm not to be okay. Either low sperm count or the quality of the sperm is bad. Apart from this, all this now, there is solution to it. There is solution to it. We can treat low sperm counts, and we can treat a cycle that egg is not being released. It may be due to hormonal problem, hormonal imbalance. We can treat all this. They are all treatable. And once you treat them and you follow them up, some of them conceive. Between 6 months and 1 year, they conceive. And they have their baby. And they have and the problem of the infertility is sorted out. Now, let me now give you the worst scenario of infertility. The woman has lost her womb. The woman has lost her ovaries. The woman doesn't have any reproductive system. Do you know that this woman can still have a child? Now, a man does not have any sperm. He does not have anything. He does not have testes. He does not have anything. The man can have a child. That is the extreme of infertility, if I want to say it. That is what we call adoption. Adoption is part of solution to infertility problem. But in our area, when we have socio-cultural problems, everybody wants to carry their baby. What is the problem? Okay, let me now lessen the problem a little. Let me come down to, okay, let's even say it as a woman. You have the womb, but your egg, for one reason or the other, cannot give you a baby. Or your husband is having sperm problem. You are intact. But your husband, there are a lot of people that donate sperm. They can get sperm donated and inject it into this woman. They don't even have to know each other. They don't even have to know the donor because of crisis of paternalism and all those. Paternity and the rest. They will just, some people donate sperm in the sperm bank. You go to see your doctor, they take this sperm and inject it to your wife. They look for the sperm that resemble you and inject it to your wife. Your wife will get pregnant. Artificial insemination. Your wife will get pregnant and will carry baby to even term and deliver your baby. It's you people's baby. Okay, let's now say that the woman does not even have the capacity. Let's say this woman is old. The woman is around 50-something years. Let's say you can have what we call surrogate mother. Surrogate mothers are everywhere. All you need to do is legal. If you volunteer to carry baby for somebody, it's legal. The legal papers are going to be signed. They are going to you don't need to meet each other. They are going to, in some cases, if you want people to donate egg and sperm and put it in somebody else and you pay for it and they give you your baby, it can be done. And it can be done in such a way that you can donate your egg and the sperm of your husband. They match it together outside, what we call in vitro fertilization, IVF. And they carry it and put it inside a surrogate mother who will carry the baby for you people. And they deliver the baby for you. And from there, the woman goes off and they give you your baby and you go to your house.
Thank you very much, sir. I'm going to just move straight to another question that someone typed here. Are there any remedies for low sperm counts or any remedies for defective sperm cell?
Yes, there are remedies. It depends on what is causing the low sperm counts. You know, there are some low sperm counts that they are hereditary, and there are some low sperm counts that are acquired. When I say hereditary now, you inherited it by the virtue of an abnormality with your testes. You know, sperm is being produced from the testes, and that is when the hormones have been released. The hormones has been released to produce the sperm. Now, if the testis is having any abnormality, there can be low sperm count. And this abnormality can come from the genetic makeup, genetic inheritance disease. There are some diseases that we inherit from our parents that can lead to testicular problem. And when you have this testicular problem, it can lead to low sperm count. These ones are more difficult to treat. But when you compare it to the acquired ones are the ones we get from infection. Because sexually transmitted disease is one of the known causes of low sperm count. And this can be treated. Once you treat the sexually transmitted disease, the sperm count can improve. There are some drugs we can give. Folic acid is one of them. You give selenium, you give them multivitamins, and you, in the next 3 months, because the cycle of production of sperm is 90 days. If somebody has low sperm count today, and immediately you have treated the infection that is causing the low sperm count, place the person on all these vitamins, folic acid allows sperm to multiply, selenium allows sperm to multiply. All this help in sperm production. And when you make it available in a good quantity for the person will take it every day for the next 3 months. By the end of 3 months, you can take the drug, you can check the sperm count. If the cause has been treated, which is an infection, the person will have been back to normal, and the sperm count is back to normal. It can impregnate a full sperm count. It will shoot up. Another thing is nutrition. Production of sperm is connected to nutrition. You need to be well nourished to produce good sperm. So if you are not eating well, it's a problem. Another problem is overweight. If you are overweight, you may not be able to produce quality sperm. So at the end of the day, you have to lose weight and have an appropriate weight before you can produce good sperm. So all these now, they are all treatable causes of low sperm counts.
We have some questions here that we've not yet even read out at all. So someone is saying, we are trying to have a baby and I'm finding it difficult to convince my guy to follow me to the hospital so that we can both be checked. Please, do you have any advice?
That has been the problem. In fact, men with their ego, we have been the problem. I tell you that I don't have any problem. And sometimes they are the problem. They are the one with the problem. In fact, most cases of infertility I've handled, we will do okay, where's your husband? The man will refuse. The man will say they should tell the doctor that he doesn't have any problem. So he has no business to come to the hospital. It's the woman that should go and get pregnant. And he's giving her 1 year. Do you know what I do for this kind of stubborn men? I will personally meet up with them. I will personally collect their number from their wives. I will counsel them. I will talk to them calmly. I will convince them through counseling In fact, sometimes I visit their homes. That is the beauty of family medicine. Sometimes I'll go down to the house of the client. I'll go and meet the man in his house. I'm Dr. Adeshida. I came from Social Hospital. I've come to see you concerning your wife, the infertility. We are partners in this. Actually, I'm not saying you have any problem. No. That's not what I'm insinuating. What I'm insinuating here is that there are some things you can contribute that can help in this problem, that we can solve it together. At the end of the day, I always win. Most times I always win. By the time I finish talking to them, they are convinced. Some is just on phone. I just interact with them, plead with them, feed the ego, calm down the ego. Who said you have a problem? I'm not saying you have a problem now. All I'm just saying is that you two come. This thing is not about this woman alone. Come, let us sit down together. Let us put it together. I am the doctor in the hospital. 3 of us are involved in this. You and the woman, the 3 of us. So we need to see and talk. And I say, okay, doctor, I'm busy at work. Okay, can I see you on weekend? No problem. I will volunteer and sacrifice the weekend. And most times, these stubborn, in quotes, women, they respond, they come. And sometimes when you now convince them and do their spam count, lo and behold, there is no spam. Sometimes some of them already know. That's why they are proving stubborn. So my advice for that person is that let your doctor speak with the man. Let your doctor undo the recalcitrancy. Let your doctor talk to the man. Most times they respect the doctor. When the doctor finishes counseling them, they are convinced and they will cooperate and facilitate in the process.
Thank you very much, sir. Thank you. Okay, so there's another question. Okay, this person has 2 questions. Who suffers infertility the most, men or women? I think that has been answered the other time.
It's equal.
Yes, it's equal. We have 20 to 30% being caused by men, 20 to 30% by women, then 20 to 30% by both men and women, and also 20 to 30% being indeterminable, that you don't know what is causing it.
Yeah.
And person is also asking, are all cases of infertility treatable? I think you also gave a response to that yes, all cases of infertility are treatable, because there's always the option of adoption, there's the option of IVF, there's the option of surrogacy, even if it is low sperm counts. I think that was what we just discussed now, that some measures can be taken for low sperm counts, which is the man can cease smoking, he can cease taking alcohol, he can go on a weight loss regimen, he can lose weight, he can improve his diet also. So I think you touched really well on many of these questions. But thank you for those that are just joining in. Just keep on typing your questions. I know he has provided many of the answers to some of our questions, but also just keep on typing in the questions. If he has already provided the answer, we'll still just go over it. So I'll just go straight to another question here. What are the tests a couple need to carry out before marriage to make sure they are both fertile?
There is a little issue about fertility test before getting married, and it's due to the social angle. A lot of people are saying that yes, to me, if you look at it strictly medically, it's a good thing. It's a good thing to carry out all those tests to know if you are fertile, to know if I'm fertile before we get into the marriage. But this has caused a lot of issues. That's why some people are believing that, okay, if you love each other, whatever the challenge you see in the marriage, can't you surmount it? Are you saying, okay, you are discarding me because, okay, I have low sperm counts? Is that everything about me? Okay, if I have low sperm counts, but I have every other thing you want in a man, can't I donate my egg and we do in vitro fertilization and then we solve the problem of children? Is marriage all about children? So these are the questions that have been raised by so many experts and so many social critics, that is not something that they should encourage. It's a different thing now. If you want to just talk about, maybe you want to prevent sickle cell disease, I want you to do your genotype, I want you to do your blood group, I want you to do 1 or 2 things, hepatitis B, hepatitis C, so that you can treat yourself. It's not to stop the marriage from taking place. It's just for you to know what you are going into. But in most cases of fertility tests, is to know if I should dump you. So that, let me quickly pick race, if you are not fertile. So there are a lot of things we can do to know if a woman is fertile, or if a man is fertile. But like I said now, there is a social angle to it, and that is the concern. But the concern be put aside. Let's now look at the test that can be done. If two of you have agreed that, okay, no matter the outcome of the test, we are still going ahead with the marriage, at least we'll be able to prepare for whatever is ahead of us. No problem. The things we can do is, number one, let's start with the woman. The woman, any woman you see that is menstruating regularly, on an average, menstruation is 28 days on an average, but it can go as far as 35 days and it's still normal. And it can go as low as 21 days and it's still normal. And the menstrual flow is between 2 to 7 days. Any menstrual flow that is less than 2 days, we consider it abnormal. Any menstrual flow that is more than 7 days, we consider it abnormal. Once you start menstruating for like 8 days and above, we consider it abnormal. If your whole cycle, your menstruation, when you see your menstruation now and when you will see the next time, your whole cycle, if it is more than 35 days, we consider it abnormal. If it is less than 21 days, we consider it abnormal. But on average, 28 days. If you see any woman that is menstruating regularly within all these ranges I've given, on an average of 28 days, and maybe menstruates for an average of 4 or 5 days, the woman is ovulating. That on its own is a confirmation of fertility. But if you now want to be doubly sure, there are a lot of strip that you can even use on your own to test yourself. Vaginal strip that you can use to test yourself. You know, there is this fluid, vaginal fluid that you produce around ovulation. It will be drawing. If you are 28 days cycle, at the 14th day, that is around the ovulation day, if you put your hand inside your vagina, there is this fluid that is copious, that is much, that is drawing. It's a sign of ovulation. And if you test that fluid, there is a way you will know that, oh, this person is likely to be ovulating. That's another confirmation of being fertile. Another way you can know that you are fertile is for you to track the egg. We can do ultrasound tracking of egg. The ultrasound can see the follicles in your ovaries. You can see your eggs coming out of your ovary. You can see them maturing. We can track it. And we see that, oh, this is the egg. And when you even ovulate, the ultrasound can show us. You can track that, oh, egg has been released. So these are all the ways you can confirm that you are fertile and you are ovulating. Apart from this hormonal test, there are some hormones that are in the body of a woman. If the hormones are balanced, it shows that that woman is likely ovulating and is likely fertile. There are major 4 of them: the progesterone, the estrogen, the luteinizing hormone, the follicle stimulating hormone, all these hormones, and the prolactin too, the hormone that is controlling breast milk. All this, we can check it in a woman. If your prolactin, the hormone that is controlling breast milk, is within normal range, and the other hormones, the 4 hormones I've mentioned earlier, luteinizing hormone, follicle stimulating hormone, progesterone, and estrogen, if they are all within normal range, the likelihood of that woman being fertile and producing egg is very, very high. If the breast hormone is too much, the woman may not be ovulating. That is why you see some ladies, they will be bringing milk out of their breast. And whereas they are not pregnant, they are not breastfeeding a baby, and they will just be producing milk. It's another cause of infertility. It is due to the excess prolactin. So that is why all this now, if you can do it in a woman and search all these, and they are all within normal range, I think the woman is fertile. These are all the tests you can do. You have to go to your doctor and he will help you out in all this. What of a man? A man's source is even simpler. If you can do sperm analysis, carry the sperm of this man and go take it to the lab and analyze it. There is an amount of sperm a man that will be fertile must have. It must not be less than 15 million. So it must be there. If it is less than that, there is a problem. So the man must, 15 billion. So it must be present in that proportion above. And the quality of the egg, the amount that is mobile, the amount that is moving well, the amount that has a normal form, that there is no abnormality, all these are very important. These are all the things. These are all the things that can give us an idea that a man is fertile. Now, apart from this, a man can be confirmed to be fertile if the man has erection in the morning. If you see a man that early in the morning, his manhood, his penis does not rise, the man may be suffering from erectile dysfunction, which can be a cause of infertility. That means the man may not be able to penetrate a woman to deliver the sperm into the woman. So that can be a cause of infertility. So there is a need to confirm from the man. In the morning when you wake up, do you normally have erection early in the morning? If he says yes, good. Then you tell the man to stay away from sex for 3 days, and you collect the sperm and do the analysis of the sperm. When you do the analysis of the sperm and all the parameters stay within normal range, the likelihood of that woman being fertile is very, very high. So these are all the tests that can be done, at least to confirm fertility before marriage.
All right. Thank you very much, sir. I can see someone raising their hand in the...
And I can see somebody typing, is masturbation related to infertility in the chat?
Yes, okay, yes. Please, let's
yes, it's related. It's related. Okay. Especially when the masturbation is excessive, it can lead to low sperm counts. When somebody masturbates too much, it can lead to low sperm counts. And low sperm counts can lead to infertility.
All right. Thank you, sir.
Hello, ma.
Yes. Please.
If the consequences of that masturbation lead to infertility, like, is it possible for someone to gain his own fertility if he ceases doing the masturbation?
Yes, yes. That's the solution, sir. That's the solution. Once you go into behavioral change, you stop masturbating. That is why, in fact, that is the reason why anytime we want to do semen analysis for patients, we ask them to stay away from sex, masturbation for the next 3 days. So by the time they are masturbating to give us their sperm, the sperm will give us quality and quantity that we need, because the man is not losing sperm. But masturbation is like a kind of wastage way of losing sperm, because every day the person is losing sperm. Of course, sperm is being produced on daily basis, but storage is being done. But the storage is not being kept because there is constant masturbation.
Okay, ma. Does that mean that masturbation is totally damaging to the health? Someone should seize it at.
It's not totally damaging to health. To be frank, it's not totally damaging to health. But if you want to look at this from spiritual angle, we have four dimensions of health. We have the physical health, we have the mental health, we have the spiritual health, and we have the social health. Those are the 4 types of health that we have generally. Now, spiritual health, almost all the major religions, which is Islam and Christianity, they frown at masturbation. So, because for you to be healthy, every aspect of those 4 healths must be healthy. So, spiritually, you're having guilty conscience for doing something. So, your health is already being affected spiritually. So, when this is there, then we don't consider you to be healthy. It is not only physical health that is the one that has to do with your body alone. That is your health. The definition of health by World Health Organization is not even absence of disease. The definition of health is for you to have well-being, physically, mentally, spiritually, and socially. So, if the spiritual health, your spiritual health is already affected because you're having guilty conscience, because you are masturbating. Yes, the masturbation, if it's not too much, if it's maybe once in a while, physically, there is no harm. Physically, there is no harm. In fact, some people even say that physical health, as far as physical health is concerned, it can even be protective against prostate cancer. But when you look at your whole health now, because we don't divide you into 4, we look at your health holistically. So when you look at your health, physically, spiritually, mentally, and socially, all the 4 must agree before we can say that you are healthy. So the question now is that spiritual health is condemning you that you are doing it, while your physical health, if it is not too much, is saying it's okay. So how do we balance it? How do we say that you are healthy when two dimensions of your health are conflicting with each other?
Okay, I understand. I get, ma. Thank you.
That is the problem.
Yes. Okay. Thank you very much. Thank you so much, sir, for the response. Okay, there's another question here. What is the effect of masturbation on woman fertility?
As far as physical health is concerned, there is not much problem about a woman's masturbation. But psychological health, there is a problem. And I will tell you the problem. When you indulge in self-masturbation as a woman, there is this less need for a man. If you're already satisfying yourself, what do you need a man for? If what that man can give you, some women use dildo, some men use artificial penis, some women use all sorts of things. Some women use their own finger, they do all sorts of things, and they will orgasm. They will please themselves, they will be very good. And then after you have done that, what do you need a man for? What do you need your husband for again? So, and if you are not having sexual intercourse, sperm is not being released inside you, how do you get pregnant? How? So at the end of the day, there is a way masturbation in a woman affects them psychologically. It makes them feel less need for a man. And if you don't have a man to impregnate you, how do you get pregnant? How? So at the end of the day, that is one of the effects. Then this one is not maybe too strong now, but let me just keep it in. If a woman just gets pregnant and the woman is getting indulged in self-masturbation, because most of the time when a woman masturbates, you know, the difference between when you meet with a man and when you masturbate is that you are in charge of masturbation and you can do it to the full satisfaction of yourself. You can orgasm. You can do it very well the way you want, and you will get the best you want to get out of it. And it can lead to a very huge orgasm. Now, how does this come into issue of fertility or infertility? Let me put it this way. Let's say as you are now as a woman, you just get pregnant. And that pregnancy is just maybe 4 weeks or maybe early pregnancy, very, very early. And then you will get indulged in a very hot and huge and serious masturbation. And this thing leads to you to orgasm and so on. It has been documented by in some quarters that when you orgasm like that in early pregnancy, as in you have a serious orgasm, a very serious one, it can lead to your womb emptying the contents. That's what some quarters said. Some people said no, it's not possible and so on. But some people, it may be a theory, but it has been postulated that it can lead to a miscarriage, which is still talking about fertility. So these are all the ways that self-masturbation can affect you.
So there's another question. Why is it that some women find it difficult to get pregnant again after their first child?
Yes, exactly. That is what we call secondary infertility. There are two types of infertility. We have primary infertility and we have secondary infertility. Primary infertility is when you have not conceived before, or you conceive but it does not lead to a live baby. That is primary infertility after 1 year in a 35-year-old person, but more than 35 years after 6 months. Now, if this occurs, you desire pregnancy after you have had a live birth, a live baby from former pregnancy, and now you are now ready to get pregnant again, and then for 1 year, in somebody who is less than 35, you are not getting results. Or somebody who is less than 6 months but 35 years old and more, you are not getting results. Then there is infertility, we call it secondary infertility. Or you get pregnant, but it does not lead to a live baby. It's still infertility. No, what is the cause? The cause is similar. It's the same thing. Now, that's where some men have issue. But doctor, I have 4 children. Doctor, I have 1 child. I'm really sorry. Let me just chip in this one. Do you know that sometimes this leads to some social issues, that things will now come out and then we now get to discover a lot of things. I'll give you an example of what happened one day in my consulting room. A woman came in, they have 4 children, and they now said they need 1 more. So I said, okay, no problem. And they have been trying, maybe going to 2 years, 3 years, they are not getting another one. I said, no problem. So what are we going to do? Okay, I sent all the children, I said they should run tests for them, they should do their genotype, they should do their blood group and so on. By the time they did all this, none of them is matching with the man's own. None. And the man believes that he's the owner of the children. Okay, to cut the long story short, we shall disclose everything. We sat down, then we checked the man's sperm. No single sperm. Spermia, no single sperm. The man is getting to know for the first time that he's trying to have the 5th pregnancy, but he's not getting, whereas the 4 is not even his children. Can you see? That's one of the causes. Because there may be one unfaithfulness or the other somewhere. By But in the absence of this, there can be true cause, like the ones we have mentioned, and that is why we have to be careful. So it's not something that is constant. It's something that we have to maintain our fertility. Fertility is not certain. You can lose it if you misbehave.
Okay. Thank you very much, sir. Are you still with us, sir?
Yes, I'm with you.
All right. Thank you so much, sir. There's another question. What can be done for a woman that often has miscarriage?
Yes, it depends on the cause of the miscarriage and the time that the miscarriages usually occur. There are majorly two types of miscarriage according to time. If the miscarriage is common in the first month or in the maximum in the second month of the pregnancy, the first and second month of the pregnancy, most likely, if that miscarriage is always happening around the first and second month of the pregnancy, it is likely that it is caused by hormonal insufficiency. Hormonal insufficiency is when there are some hormones in the body of a woman that will maintain pregnancy in the first and second months. If those hormones, if they are not there, like progesterone and estrogen, if they are not there, the baby will come down. And there are some people that have been diagnosed to have insufficient hormone. So they can get pregnant, but the hormone is not sufficient to maintain the baby in the first and second month before the placenta will develop and now sustain the baby. Because placenta doesn't develop until the end of the third month. That's when placenta will develop and now be feeding the baby until the woman will deliver. And that is why when you deliver a baby, you cut the placenta. It is that placenta that is feeding the baby. But placenta does not start feeding a baby until the 4th month. So from the 4th month to 9th month, placenta will take care of the baby. But in the first 3 months, in the first 2 months especially, it is the hormone in the body of the woman that will take care of the pregnancy. If the hormone is not sufficient, then the baby will continue to come down consistently. And that is what we call recurrent abortion. So the solution to this is that if the woman is having this type of problem, the woman needs to come to the hospital. Doctor needs to place the patient on external hormone. And that external hormone will go a long way to maintain the pregnancy for the woman until placenta will take over in the 3rd and 4th months. That is number 1. Then number 2, if the miscarriage is occurring around 3 to 4th months of the pregnancy, then it's likely caused by what we call cervical incompetence. Cervix is the door of the womb. And in some people, the door is very weak. Maybe due to the abortion they have done in the past, the man has used iron to injure the door of their womb. In some people, it is because their mother born them like that. They gave their birth to them like that. Maybe the things that their mother ate, the drug that their mother took in pregnancy, affected the womb of the baby inside the mother. It can happen. There is a drug we call testosterone. It has caused that in so many people. The mother will take it when they are pregnant. The testosterone will go and affect the womb of the baby that is being carried. And when the baby is born, the baby will now be suffering from a womb problem, from the door of the womb being weak. This can lead to recurrent miscarriage. We call it cervical incompetence. If this is what the person is having, then the person has to come to the hospital. There are some tests we can run and discover this. And then we will tie the womb so that the baby can sit on the womb. So when it is time for the person to deliver, then we just cut the something and then the baby will come out.
All right. Thank you, sir. So we are about to wrap up the session, but I think we have a final question here. So when can a woman that delivered through CS take in again such that her health will be protected?
The woman should take in after, when you do CS, at least you must not deliver below 2 years. Your next baby must not be less than, by the time you are having the next baby, that CS must have been done at least 2 years. And pregnancy is 9 months, so we can do the mathematics. I don't know if you get what I'm saying. So we can now do the mathematics now. So that means before you even start trying at all, it must be at least 15 months. 15 months. Immediately you have CS, go and do family planning. Go and do family planning to protect your womb. Stay until at least 15 months. That is 1 year, 3 months. 1 year, 3 months before you start trying. So that by the time you start trying 1 year, 3 months after the CS, if you take in, that means by the time you are delivering, it's already 9 months after. I mean, it's already 2 years after the CS.
All right, sir. Okay, so sorry, I know I said that was the final question, but I see someone asked a question on IVF. Yes, sir. So the person is trying to know about the cost of IVF. If you have an idea of the cost.
It actually varies, but on an average now, let me say 700,000 to 1 million on an average. In some people, in some places, some collect 500,000. In some places, some collect 1.9, 1.5. But on an average, between 700 and 1 million.
Between 700,000 and 1 million naira. All right, thank you, sir. Oh, sorry, we keep getting questions. I just saw one now. What causes hyperemesis gravidarum? Can it be prevented so that it doesn't happen at all?
Actually, I don't know. Some people say it can be prevented. Some people say you can take some drugs before you get pregnant and so on. But in most cases, hyperemesis gravidarum is common in first-time mothers. First-time mothers. And why is it common in them? It's common in them because that is the first time they are carrying another woman being inside them. Their body is not used to it. So their body is reacting. Their hormone, they are producing hormone effectively. You know, when it's as if something like a stranger is inside your body and your body is not finding it funny. And sometimes it's because the hormone of pregnancy is exaggerated. The hormone of pregnancy is much. Let's say now the progesterone, the estrogen, and all those things that you are supposed to have in pregnancy. But because this is your first time you're having pregnancy, the thing was overproduced and they are very high. Apart from this, the baby itself is like a stranger in your body. The baby too is like your body is like, we don't know you. You don't know us. What are you looking for? What do you want to find there? Can you leave us alone? And they will begin to fight. Your body and the pregnancy will begin to fight. The hormone will be high. Everything, they are coming together to cause the problem. You are vomiting. But usually within the next 3 months or 4 months, the fight must have been settled. The body will now say, okay, this man, we have even been fighting for the last 3 months. The body will now develop tolerance and say, okay, you can stay. Maybe you are not staying more than 9 months. Okay, stay for 9 months so that you can stay and go your way. So that is why you don't see it commonly in second, third, fourth pregnancy, because at that junction, the body is now used to having a stranger around, and then they will now tolerate them more, and then the person will vomit less. So it's very common in first pregnancy because that is the first time that they are having a visitor, and that is the first time, and it can lead to the hormone being produced so much, and this can lead to them vomiting too much, that they will need to be admitted, they will need to be given drip, they will need, in fact, some will not even be able to eat. You have to place them on fluid, place them on so many drugs, keep them for 3 months. Some will even be on a hospital bed like that, for 3 months, for more than that, until they will now get out of the whole thing, and then they can now continue. But by the time they're having their second, third, fourth pregnancy, the problem has come down. But there are some people that they will have it throughout. Second pregnancy, they will have it. Fourth pregnancy, they will say their body is not tolerating the baby.
All right. Thank you, sir. I'm getting so many questions here. I know we're about to round off, but please, if you can just answer some of these few questions here, we'll just give short answers to it so that we can try to wrap up the session here. So this person is asking that why is it that family planning fails, and then is it safe without side effects? Why does family planning fail, and then is it safe without side effects?
I will not lie to you. The only family planning that cannot fail is happiness. That is the only family planning method. When you and the man are not doing anything, that is the only one that is 100% safe. Every other family planning, a man is just trying. It's all man-made, and they all have their failure rates. All of them can fail. From injection to implants, to condom, anything made by a man has its own failure. It may be 3%, it may be 0.5%, it may be 1%. It is human error. It can't be perfect. So there is nothing anybody can do. It is inherent in it. So the only one that is totally safe, 100%, is abstinence. It's just the way it is. I have to tell us the truth. And there is none of them that does not have side effects, except the abstinence. If you stay away from abstinence, is the only one that is 100% safe without side effects. Like I said again, anything made by a man has side effects. Implant, hormonal, IUCD, condom, all of them have their own failure. All of them have their own side effects. Some people react to condom. Some people, if they use condom, they'll begin to itch. All of them have side effects. The hormonal, some will menstruate too much. Some will not even see their menses. Some will begin to get fat. Some will begin to get thin. All of them have their own side effects. It's just the way it is. Every drug has side effects. The same thing with family planning.
Thank you, sir. Thank you so much, sir. I see that we still have some questions. Please, we have, in the next 5 minutes, we are going to be rounding up the session. So please, any other question that anybody has, please, let's just put it in the comment section on our website, and we'll find out to respond to the questions on the website. Okay, because we want to wrap up in the next 5 minutes now. But before we go, I see someone asking here that a woman has miscarriage every 5 months. What can be done for her? Then someone is asking how long a woman should stay before getting pregnant if she has done a fibroid operation. So, Sabi, if you can just help us answer those two questions in the next 2 to 3 minutes.
This miscarriage of 5 months is likely to fall into that second type I talked about, which is cervical incompetence. So the person has to go to hospital and see a doctor. They will conduct tests on her womb. If they confirm that the door of her womb, which is the cervix, is not strong enough, then they have to tie the womb so that will not occur again. And the person will carry it to 9 months and deliver. And then after fibroid operation, the least, I repeat, the least time you should even begin to try to conceive, the least is 3 months. The least. That's the least. Because the wound has to heal.
All right. Thank you, sir. Thank you so much for your responses. We really appreciate it. I'm sure people both on Zoom here and on our website, they have really learned a lot tonight. I've also learned a lot personally.
I saw one here. A man is asking that, can a man take folic acid? The answer is capital yes. It's very good. Very good for a man. It makes your sperm to be quantity and quality. Very good for a man. 400 microgram every day, one daily. Every man should take it if you're in reproductive age. It gives you a quality sperm. Just the way a woman is taking it is recommended for a man. It's recommended for children. It makes them to grow very well. Folic acid is a family drug. Folic acid is a family drug. It's supposed to be taken by the wife. It's supposed to be taken by the husband. It's supposed to be taken by children. It has advantage in all the family members. For the woman, it makes you to have good egg. For the man, it makes you to have good sperm. For the children, it makes them to grow very well.
Thank you so much, sir. We really appreciate all your responses. Thank you very much. I'm sure everybody here too is saying the same. Thank you very much for responding to our call. And thank you for everyone who also joined into this session. I'm sure we all learned a lot from this. So as I've said, you can always visit our website. You get a lot of health information from there. We discuss very important health information from time to time. And we also put out quizzes that you can take that helps you to correct a lot of misinformation that you might have about certain health conditions. Thank you all, everyone, for joining. And I want to say good night to everyone. Have a nice day and enjoy the rest of your day. Thank you so much.
Bye-bye.
Bye. Bye, everyone. Bye.